A survey commissioned by Quinn Healthcare this week has revealed that over 54% of people are unable to attend their local GPs due to financial constraints. I'm here at the Dean Street Medical Centre to talk to Dr Tadhg Crowley to hear how Kilkenny has been affected. Tadhg, thank you for talking to 32.ie today.
No trouble.
In your opinion, is this survey correct? Are numbers way down?
Well, no, Tracy, there's no doubt about the numbers are definitely down. I wouldn't have realised from our own practice and talking to other doctors around the place that it would be down 69%. Certainly there's two aspects to general practice. There's people who have medical cards and are covered by the government, and there's people who have to pay for further visits to the doctor. So we probably noticed that a decrease of about 20-25% in private patients attending. Doctors have noticed they're busier though, because there's probably more medical card patients attending, but also the private patients that are attending, we certainly have noticed an increase in what we would call mental health issues amongst the population.
Why so?
Well, I suppose in the middle of a recession, and a deep recession that's happened, people have lost their jobs, and people have severe financial crisis going on in their own lives, and it's affecting them from a depression point of view and causing anxiety symptoms, and obviously this is putting huge pressure on them financially and personally amongst their work colleagues, themselves, their families, and also amongst their relationships.
And are people waiting until they're very sick to come to the doctor?
You definitely find, yeah, that whereas in the height of the Celtic Tiger, if someone had a cold or a flu, they'd definitely be in the following day, whereas now they certainly wait until they are sick, and they probably have 3 or 4 complaints coming in at the one time.
So general checkups are down?
Yeah, which is worrying from a sort of part of our job is to be proactive in primary health care, and is trying to encourage people to attend the doctor early so that we can look at preventing cardiovascular deaths and stuff like that.
And how often would you recommend a checkup or more?
Yeah, I mean once you get to the age of 40, you should be coming to the doctor once a year for a checkup, and generally during a checkup it's a weight, height, blood pressure, sort of a systems review to find out how life's going, and generally the doctor will do some bloods and look at sort of cardiovascular risk markers that we can work on trying to reduce down the incidence of these diseases further on. The country is in the middle of what they call an obesity epidemic at the moment, so huge numbers of people are overweight, and that ranges from children at school to middle-aged people to elderly people.
Do you see a lot of that in Kilkenny?
Huge amount, yeah, huge amount. So it causes huge problems. Again, obesity doesn't cause a big problem straight away. It's 10 years on the road when increasing diabetes.
And that's probably a result of cheap food and things like that again.
Bad eating, cheap foods, yeah, that's right, and people are under pressure for time, so they don't have the exercise is the thing that goes out the window. Their dietary habits are poor. So despite the fact that we're sort of in an internet technology era, and that there's so much information out there on lifestyle, there has been so much pressure on people's time that everything healthy is thrown out the window. Is
the big difference still there between male attendance and female attendance to the doctor? Has that got worse?
It has. I suppose there's a couple of things you would say. Although there's more information out there, it's still a huge problem. And probably particularly more so in a recession, that you often find, especially in a family situation, the father will deprive himself of a visit to the doctor. He's the last one to attend.
Really?
Yeah, because he'll suppose inherent in him is that he'll only attend when he's very sick. Preventive health wouldn't be in the male psyche. To be attending a doctor to prevent diseases.
And can you think of any solution, Tadhg, for this, like financial constraints and GP visits? Is there a solution out there?
Well, I suppose there are several solutions. I mean, if you look, I suppose there's micro solutions and macro solutions. If you look at the macro solutions, you look at the political parties, and they're talking about making it universal healthcare and focusing on chronic diseases as an element of the way we work. And I think that probably will actually work, that if you make it free to people, and people will attend the doctor then when it's free. I think that will be a solution down the road, and it'll also get us to look at sort of chronic diseases. When I talk about chronic diseases, I'm talking about cardiovascular diseases, I'm talking about obesity, I'm talking about cardiac diseases and asthma and chronic obstructive airways disease. They're the sort of major ones that you'll get them to attend the doctor, to look at the medication they're on or that they should be on, and then hopefully prevent problems down the road. Then sort of on the micro level, at the local level, I suppose there are methods taking a look at what people are entitled. A lot of people don't actually realise they are entitled to medical cards, or they might be entitled.
Where can they check that out?
They can check it if they can check it with their own doctor, would have the information. The government websites, the HSE websites will actually give good indicators whether they're entitled. A lot of people don't realise that along with the medical cards, they're actually also entitled to doctor-only cards, which means that their visits to the doctor would be free. They might have to pay for the medication, but that there would be cards out there that they could get a visit to the doctor. And that's something that when people aren't used to it, they don't bother looking into it. But it would be well worth checking.
So that's really what you recommend to people in Kilkenny, to check out?
Yeah, it's very important. And also if you have a long-term illness, and say someone presents to the doctor, they go for a checkup and it shows they're obese and they're diabetic and they've got various diseases, the medication they're on they'll actually get for free because they'll be on a long-term illness book. So they apply for that scheme as well.
Excellent. I think that's all, Tadhg.
Okay.
Yeah, thanks for talking to 32.ie.
Absolutely.